Welcome, everyone, to the Tiger Optimal Health Podcast. And today we have Chief Medical Officer of Tiger Medical, Dr. Matthew McNamee. Matt, welcome.
Thanks, Steve. Appreciate it. Thanks for having me.
You bet. And just real quick, Matt, Dr. McNamee has 15 years roughly of clinical practice. He's a naturopathic physician in Seattle, Washington area, and has had some very unique medical training. And today what we're going to talk about is something that a lot of people don't know about. It's called the endocalyx. Matt, can you describe for people what this is first?
Yeah, so endothelial glycocalyx. Endocalyx was a nutraceutical used to treat the endothelial glycocalyx. So backing up. So basically, your question kind of goes to the cardiovascular system. It's the basically the plumbing. So our blood vessels, we have 60,000 miles of blood vessels, and the inner lining of the blood vessels has this, these endothelial cells. So the cells that kind of regulate. It's kind of like a filter. What regulates what goes in and out of the blood to your organs, right? It's in your tissues and cells and all that. So the glycocalyx is this kind of gelatinous. It's like a gel-like material. It has these little hair-like projections that can sense, like little sensors, that are all these cells that line that 60,000 miles of tubing, the blood vessels. And it serves as basically a protective mechanism. It has, all kinds of benefits from, it regulates inflammation, it regulates clotting, it regulates oxidative stress. So people hear about antioxidants, things that are oxidative damage things. And so it has like this antioxidant to protect the vessels. It has an anti-inflammatory, so there's not too much inflammation or fire going on. It helps produce molecules that help dilate your plumbing, so blood pressure and things like that don't go up. You get more blood flow to places that you need it. It keeps basically foreign things out. So it's kind of similar when I've talked to people about the gastrointestinal endothelial lining. That regulates what the body can take in and what it shouldn't be taking in, right? So they both kind of serve essentially as filters.
And what happens, Matt, when that gets compromised?
Yeah, so for simplicity, you just kind of almost look at the opposite, right? So if you can't dilate the plumbing as well, blood pressure goes up. If that glycocalyx is damaged, right, you've got inflammation can go up, right? If that's damaged, the antioxidant compounds and stuff that are or molecules that are in that gel-like material aren't there to protect the lining. So you get damage. Net result essentially is damage. You get essentially, things from the bloodstream start to get, almost basically lodged within the arteries, and you can get, immune cells and, other inflammatory chemicals or signaling molecules that get in there, and ultimately the net result is you end up with inflammation and lining of the vessels. They turn to plaques, and the plaques, at some point can potentially rupture, and that equals potentially a heart attack or a stroke. So those are kind of some of that's kind of a simple way of looking at it. You end up with, depending on the organs that are affected. I mean, if you look at the brain, you can get cerebral vascular disease. People can end up net result after that, and you can end up with things like dementia or cognitive changes. When it's damaged, I mean, there's a whole host of conditions that people can get, including I mean, everything from diabetes to kidney problems, Of course, the cardiovascular stuff.
You have a unique angle on this, given your training. You're really an expert in the brain-gut axis, and you have a saying about leaky. I don't want to steal your thunder, so I just say it that way. That can really have an impact on your vascular health. Do you want to unpack that?
Sure. So, I was telling my wife a few weeks ago or something. Basically, the gut is the gateway to health. It's your gastrointestinal tract. The gastrointestinal tract essentially is the interface between the outside world. Most people think they're skin, but I mean, the reason we have 70+% of our immune system in the gastrointestinal tract is because that's where we encounter most of the foreign stuff in the environment, or the stuff that we swallow and everything. So we've got foods and toxins and different microbes and stuff that the immune system comes in contact with. The gastrointestinal tract, and basically, like I said, it's similar. It's supposed to filter everything, take in nutrients and stuff, and keep the foreign stuff out. But what happens is, I mean, similarly, like the gastrointestinal tract, the lining's a single cell thick. It also has endothelial tissue, just like the lining of the vessels, and it's about the thickness of a paper towel, and it roughly has a surface area of a tennis court. And that's where you got all the immune cells on one side, and all the other stuff that's supposed to stay in the lumen, or inside the gastrointestinal tract, supposed to stay within there. What happens is, for a whole, there's all kinds of different reasons, but there's simple as someone could be stressed. I was talking to one or two of the people I was working with, patients this week, is the type of people that I see, professions and all that. I mean, one of the common themes with 5+% of them, high stress, right? So just having stress can damage the lining of the gut, create inflammation, and basically cause, the stuff from in your gut to leak into the bloodstream. There's all kinds of other things that can cause it, even just an imbalance in the bacteria. I was mentioning to you earlier, I was working with two people this week. Neither of them have gastrointestinal symptoms at all. Like their gut health is very, very normal, fine, right, regular. But through testing, one of them has, a very severe kind of dysbiosis where they have too many bad or problematic or opportunistic, microbes, bacteria, things like that, yeast, things like that, and not enough of the helpful guys. So their garden essentially is overgrown with weeds in their gut. And then the other one, has pretty compromised gut barrier function. So the lining's damaged. Now things are getting in, from the gut into the bloodstream. And what happens is, that stuff is super inflammatory. And the reason I ran I did a stool test with this woman, given she didn't have any symptoms, was she had a very high inflammatory marker, this high sensitivity CRP that we test on everyone. And we're working on stuff and it wasn't coming down. And I said, we got to look at your gut. And we finally looked at the gut, and she does. She's got this, these microbes that create a lot of this very inflammatory stuff called lipopolysaccharide, and it's basically a toxin within. We call it an endotoxin. So within the body, that's all of us have. But for those that have either too many of those problematic microbes, or the lining, the filters damage, that stuff gets into the bloodstream one way or another, right? So anyway, then what happens is the immune system ends up basically becoming overreactive. You get this immune dysregulation. All the military defenses sound the alarms. Everyone's on heightened alert, and they try to attack all this stuff, right? And then you get that contributes to some of this systemic inflammation. And then, the lipopolysaccharide, we call LPS for short. You can just type in LPS and, anything from anxiety or depression. It not only goes into the bloodstream, but then it goes other places and creates inflammation, gets into the brain, But but that's just very inflammatory, and that can really, that coupled with the other stuff that gets into the bloodstream from the gut can really chew away at the glycocalyx. And when that gets damaged, that can affect the brain and the blood-brain barrier. So you can get some leakiness in the brain, and then stuff that gets into there, it's not supposed to get into there. And then you can get basically leaky vessels. There's a cardiologist that kind of coined the term leaky heart. So those 60,000 miles of vasculature can become kind of a little leaky, right? And that equates to problems. So
some of the downstream effects then is when that gut, and not a lot of people are talking about that, when that gut is wrong, inflammation is a big outcome of that, and it affects the whole body. And so one can have bad plumbing in the heart, bad plumbing elsewhere, which can lead to things like blood pressure spikes, treatment-resistant hypertension, diabetes, stroke, heart attack, but also mental health too. What I heard you say was it gets in the brain, and now there's a lot of people. I know I've watched you help resolve a lot of people that had long-term anxiety, panic attacks, things like that. You were able to restore that because you restored their gut.
Yeah.
Among other things.
You can another search, you can look under one of the, either Google Scholarly or PubMed or one of these things, and it's, I'm sure they have, titles something along the lines of, inflammation and depression, right? So, we know that, and it's not every case, right? But there is a large fraction of the individuals with depression is driven by an inflammatory process.
Yeah.
So it's trying to figure out what's causing it. Some people have the genetics to create some more of these more pro-inflammatory cytokines, these immune signaling molecules that drive inflammation. Some people, if their gut is, and then it's kind of a whole cocktail of it. And if they have that, and then their gut's off, that can drive it.
Right.
With even, and not to get too thrown off track, but like even with individuals that are overweight or obese, those fat cells secrete one of these very pro-inflammatory cytokines, interleukin-6, which easily gets into the brain and turns on that whole inflammatory process. Even just helping people with weight loss can lower the inflammation and potentially help with mental health. So yeah, it's looking for the sources, but I've probably run well over 1,000, stool tests in over 15 years practicing. And a pretty decent percentage of them, when we used to test, even in some of our programs in the past where we test everyone, and there's a pretty solid percentage, I'd say even half that, no gut symptoms at all. And
wow,
I've seen, scale of 1 to 10, 10's really bad. I've seen a lot of 10s, right? So
and gut health is something that's not a one-time fix. It's got to be pursued the whole rest of your life, maintaining good gut health.
Well, and part of, anyone that's done any functional medicine training, they call it the 5R program to basically rebuild your gut health. The last step, and it's often missed, has to do essentially with kind of like rebalancing the body and lowering stress levels. You could do everything under the sun, otherwise, and address everything, pull out triggers, add the good things, take out the bad, heal lining of the gut. And if someone's stressed, you're just not gonna, you won't get there, right? You won't be able to heal the gut.
That's why we have like our 8 health habits, because one, in my view, 3 of them relate to stress. One is our breathing program we teach, sleep is another, and then daily movement. Because daily movement triggers all that cocktail in the brain that makes us healthier. Matt, we're going to talk real briefly here. So what's really cool is there's, for the last 15 years, a company that I'm now involved in, so I'm going to be full disclosure about this. It's called Glycocheck US. There's a medical device that actually can measure the health of this glycocalyx that you're talking about. I don't know. I don't know how much time you've had to study that. Do you understand how it works, or do you want me to describe it, or do you want to tackle that?
Yeah, I mean, essentially the ingredients help, basically build. It provides the backbone to help, basically form the gelatinous layer.
Yep.
So that's a component.
Supplement. Just to clarify for everybody, now you're talking about the nutraceutical supplement to help somebody. Go ahead and finish this though. This is good.
Yeah, so it has, those building blocks to kind of basically, just to simplify it, to build that gelatinous layer. It provides, a couple of things in there. So it's a couple towards that. A couple ingredients go towards building, things like nitric oxide that help, dilate the vessels. And then there is some pretty potent antioxidant support that helps, protect the glycocalyx. That's kind of a very just surface overview.
Yeah, no, that's good. And the product's called Revasca. You can just look it up. It's Revasca. It's at glycocalyx.com, which is glycocalyx.com. It's taken me a while to learn how to spell that really quick like that. And that'll be in the show notes. But also there's a device now called the Glycocheck that it's in about 140 research hospitals and universities around the world. It's been so for the last 15 years under intense study. It's been highly validated, and now it's in about 50 clinics in the US. And that's going to be expanding pretty rapidly in the next several years. So you're going to actually be able to go do a 2-minute test under your tongue and get a score of 0 to 10. And what's really important about that is the company has done a study. It was over 6 years that validated a claim that we can make, and that it's 90% effective in predicting who in the next 6 years will have a heart attack or a stroke. And the important thing about it is that it identifies based on your score correlates with certain risk profiles. You can know this and get really proactive about it, and not just sitting, waiting back, only relying on statins or just saying, oh, my genetics are my destiny. That's just not the case. And so, but the thing I want you to unpack, Dr. Matt, is someone can get a test score. Okay, I got a problem. They get on the supplement, but if they don't change their lifestyle, it's really going to kind of offset the supplement to some degree. That's where Tiger Medical comes in, because we practice something called, there's lots of names for it, but it's lifestyle medicine, it's root cause medicine. Do you want to describe for the listener, what does that look like and why does it work so well?
So, the lifestyle fundamentals, you can almost look towards any chronic health condition, probably, man, I would think there's a correlate between what people put in their body food-wise, how well they sleep, what their stress levels are, how much they move, is it too much, too little, what we're drinking, breathing in the air, pollutants, things like that, and all the negative consequences, with health. So, speaking about the endothelial glycocalyx, that's like we talked about earlier, stress with the gut. Stress is a big, component that can damage the that gel layer. We talked about the gut. Diet is a big one, right? A lot of people eat, high sugar, pro-inflammatory, very, very inflammatory foods, which will damage it. I was trying to dig in to see if I could find anything on sleep, but it doesn't seem like there's any direct research yet. I'm pretty confident they will at some point make a direct correlation. It's like the in-between. We know that it damages the endothelium, and we know that typically that starts with the glycocalyx, that gel layer. So, and then movement practices, most people are, if they need to optimize that, they are more on the sedentary
Yeah.
and things versus, exercising too much. But I do occasionally get some people that we need to tone it down a little bit.
Yeah.
But, those kind of basic fundamentals, you can correlate towards brain health or disease, right? Gut health or disease, and then ... So I mean, they're all tied in. So it's not surprising that at least the research that they've done around this so far, that they're able to tie in, nutrition, movement, stress, things like that.
Yeah. Well, thank you. It's we've been doing this now 5 years, and we've worked with hundreds of patients, and it works every time when they show up, and because it's a process that works, because Matt is working from the root cause and finding what's underneath the hood that's causing the condition. You go to work on it, you support it, and you change lifestyle. And so Revasc is just one of many things somebody like Dr. Matt would use with you. It's a 1-year process, and then it's really continuous from there on out the rest of your life. So anyway, if you want to know more about this, if you'd like to learn how you could work with Dr. McNamee, go to tigermi.com and just book a call, and you can meet with me or one of our professionals. You can also contact us on the website, and it'll get to me. If you are interested in getting a scan, a store I own, it's called Nassau Health Foods in Fernandina Beach, Florida. It's on Amelia Island. We're going to have, beginning in February, we're going to have one of the first devices in a health food store in the world. And you can get scanned there if you really want to find out. But anyway, go to tigermi.com and learn more about how you can work with Dr. McNamee. Dr. Matt, thank you so much for being on the podcast today.
Yeah, thanks for having me, Steve.
Steve Adams here from Tiger Medical Institute, talking about the True Health Assessment. What if you could safeguard not just your health, but the well-being of your entire family? With the True Health Assessment from Tiger Medical, you can. Our comprehensive blood screening identifies hidden risks before they become major issues. Our elite team of Mayo Clinic trained and naturopathic physicians then create a customized plan to optimize your health for years to come. When you prioritize your wellness, you ensure you can be fully present for the people you love most. Don't let preventable issues cut that time short. For less than the cost of a daily latte, you can gain peace of mind and a clear path to sustained vitality. Protect your future and your family's future with True Health Assessment from Tiger Medical at thetruehealthassessment.com. Again, that's at thetruehealthassessment.com.